There are a lot of tax advantages with health savings accounts, but a lot of people have questions about them as well. So maybe my next guest, Dennis Triplett from UMB, can answer them for me. Welcome, Dennis.
How are you?
Not bad. All right, let's start off with the basics. What are health savings accounts and what are those tax advantages?
Okay, first is a health savings account is an account coupled with a high deductible insurance plan provided by your employer typically. The tax advantages are threefold. You can put the money into the account and have a tax deduction associated with that. Your dollars can accumulate tax-free, and you can take them out without a tax consequence as you need to or when you spend for eligible medical expenses.
And you can choose and direct where those dollars will go. Can you choose the mutual funds you want in those accounts?
Absolutely. Most people put their money in the base deposit interest earning account, and then after they hit some threshold balance, then they're free to invest those dollars in mutual funds, provided that the HSA custodian offers those funds, and typically they will.
And what about restrictions and liquidity? Can people get to those funds if they need them?
They can get to them for eligible medical expenses. If they choose to spend their money and for non-eligible purposes, there is a tax consequence of 20% associated with that.
One of the big knocks on HSAs is that they're only good for young, healthy people. How do you respond to that?
That was an early objection, and we heard it very often, but that's simply not the case. It's designed for anyone that wants to save money looking forward to medical expenses in their retirement. So it's simply not true regarding the young or the healthy population. They work for everyone. And
how high a deductible? Because a lot of people say it has to be a very high deductible to make it worthwhile.
There's a statutory number of the minimum deductible that it needs to be. Probably the more common plan we see is a $2,000 deductible for an individual or a $4,000 for a family. And that's the typical deductible that we see for these plans.
All right, so why should someone buy an HSA from UMB, to use all those acronyms, instead of somewhere else?
First of all, we do some things that I think differentiate ourselves from others. We look and consider communications is really a key to make sure that the people understand what their benefits are, how to use that HSA. We try to encourage people to understand that the S in an HSA is for savings, and these vehicles are really designed for that. Ease of use is critical, so people have the ability to invest, they have the ability to see and transact with these and do it all over the web, as well as having a debit card attached to that account.
All right, thanks a lot, Dennis.
Thank you.
Thank you for watching The Street.